I welcome you to the fourth lecture of this NPTEL MOOC course, Psychology of Stress, Health and Well-being. This is overall fourth lecture, but this is the first lecture for module 2. So, in today's lecture, we will talk about the relationship between stress and health. So, stress and health will be covered in 2 lectures. So, in one lecture, we will talk about the relationship between stress and non-infectious diseases, and we will talk about in the next lecture the relationship between stress and infectious diseases. So, we will have 2 lectures under this title. So, obviously, today we will talk about the stress and health, particularly in the context of stress and non-infectious diseases. So, before we talk about today's lecture, let us have a brief recap of last lecture, that is lecture 3 of module 1. So, in the last lecture we talked about the physiological aspects of stress. Basically, we try to understand how the experience of stress causes various physiological changes in the body. So, in that context we have discussed the fight or flight response, which we have is also called as acute stress response, where we try to find whenever we discussed that whenever we experience stress, the immediate reaction of the body is fight or flight, where the body gets aroused and there are certain symptoms in terms of increase in heart rate, perspiration, etc., and the body gets extra energy to deal with various threats and dangers in the environment. So, this is a natural response that we all experience whenever we experience stress or threat in the environment. We have also discussed general adaptation syndrome. So, in the general adaptation syndrome, we discussed how our body responds to both short term as well as long term stress. And we have discussed there are 3 stages in which the body goes, or body kinds of experiences certain changes when they encounter stressful circumstances. So, we have discussed alarm reaction stage, resistance stage, and then exhaustion stage. Then we have discussed how stress is connected to the brain and body, particularly in terms of physiological reactions. In that we have discussed particularly that whenever we experience stress amygdala is activated, and then it further activates hypothalamus, which then activates 2 pathways. One is called as SAM pathway, and another is called as HPA system or SAM system. So, there are 2 pathways by which body kinds of response to stressful experiences. In the SAM system, basically, which is called as sympathetic adrenal medullary system, where body activates the medulla or the inner part of adrenal gland, and which secretes adrenaline, non-adrenaline hormones, which has then further other implications in the body. Similarly, hypothalamus also activates HPA system, which is called hypothalamic pituitary adrenocortical system, which activates cortex of the adrenal gland, and it releases hormones such as cortisol. So, these hormones are released in the response to various stressful experiences, and they have many consequences in the body. Then we have also discussed the connection between stress and brain, and we have discussed stress particularly influences 2 parts of the brain, that is, one is called as hippocampus and another is prefrontal cortex. Hippocampus is mainly responsible for learning, memory and emotions. Prefrontal cortex is primarily responsible for higher cognitive functions or executive functions, such as regulating thoughts and emotions, decision making, etc. So, stress can influence these 2 parts and adversely impact these functions. We have also discussed gender differences in the stress response, particularly in the fight and flight response. So, some research suggests that obviously fight and flight response is kind of universal, but females are more likely to show another kind of little bit different response, which is called as tend and befriend response, where In the 10th section, basically under stressful circumstances, the females are more likely to show nurturing activities for protecting offsprings and dependents in order to reduce stress and protect the dependents. In the befriend concept, basically the females are more likely to create and maintain social network for protection and reducing stress. And we have discussed this may have evolutionary reason why it happens, that because females are more likely if they were given the role of protection of offspring throughout the history, and fight and flight response may not be very conducive for such functions. So, tend and befriend probably is an evolutionary functions for protection of species. So, these are some of the major concepts that we have discussed in the last lecture. Today, we will talk about some of the major concepts, such as we will talk about historical background of stress and health research, how stress is connected to health, and we will see some of the historical antecedents of research, particularly how research evolved in terms of finding this relationship. Then we will also discuss various pathways linking stress and health. What are the mechanisms by which stress influences our health, particularly physical health. And then we will discuss stress and non-infectious diseases in particular, and we will see some of the examples of it in today's lecture. So, let us start. Now, the stress in itself is not an illness, because it is more like a response of the body. So, it is a natural response of the body. So, this itself is not an illness. However, it is more an unpleasant experience, particularly we experience negative emotions. However, the various research have shown that stressful experiences can lead to various physical and mental illnesses or conditions. So, in itself it is not a problem, but when we experience it too much, or especially the chronic stress, it may lead to various other both diseases, both physical as well as mental illnesses. We have already discussed there are many staggering statistics associated with the adverse impact of stress. In the context of health also we have such statistics. Now, some surveys shows that stress is the #1 threat for health in the US, and about 70 to 90% of doctors' visit are related to stress. So, there are so many such statistics. So, this is not just for the US context, but it is true for most of the other countries also. Now, this relationship between stress and health can be explained primarily from the context of the mind body connection. When we talk about mind body connection, the idea is that the mind and body are not two separate entities. They continuously influence each other. If you look at historically, 17th century French philosopher Descartes kind of proposed the idea of mind body dualism. So, where he proposed that mind and body are two separate entities. However, recent researches clearly indicates beyond doubt that mind and body are not two separate entities, rather they are very closely connected to each other and continuously influence each other. So, and in that context, in the mind body connection, there are many areas of studies have been established and they are flourishing. We have mind body medicine, we have health psychology. All these are primarily psychoneuroimmunology. All these areas are based on the foundation of mind body connections, and people are trying to understand from the diverse perspective how mind body interacts and what are the consequences of it, what kinds of therapies and medications can be developed based on these ideas. So, the modern research, it is kind of beyond doubt that there are a strong connection between mind and body, and they are not seen as a separate functioning entities, but as one functioning unit. So, mind and emotions are viewed as influencing the body, and as the body in turn can influence our mind and emotions. So, this is the basic idea between in the concept of mind body connections. Furthermore, when we discussed the physiology of stress in the last lecture, it was evident how mind and body is very strongly and closely connected to each other, because we have seen when we experience stress at the mind, at the mental level, and how the mental experience of stress influence our body in so many ways and leads to the release of various hormones and impact our bodies, the various organs of the body such as heart and other and endocrine glands directly because of our mental experiences of the stress. So, this was very evident in the discussion of in the last lecture, particularly when we discussed the relationship between the biology of the stress. Now, in terms of this mind body connection, obviously we need to understand the concept of psychosomatic diseases. Now, so psychosomatic diseases are basically physical diseases that are caused or deteriorated by mental factors such as stress, anxiety, depression, etc. So, these are category of disease where the symptoms are in the body, but causal reasons could be in the mind. So, the idea of basically these are two terms, one is called psychosomatic. So, if you look at it, so psycho is basically connected with the mind, somatic is connected with the body. Soma is basically means body. So, these psychosomatic diseases are basically such diseases where mental factors plays very important role in terms of expression of physical symptoms of diseases. So, researches very clearly shows this bidirectional relationship between the body and the mind, and these psychosomatic diseases are an expression of that relationship. So, psychosomatic diseases involve both mind and body, and it refers to physical symptoms that arise from or influenced by the mind and emotions rather than specific organic cause such as injury. So, there are in such diseases there may not be very specific organic reason in the body such as injury in the body or in the body parts, but these may be caused by the mental factors. So, when we talk about psychosomatic diseases, we need to understand that also there are mental aspects in various in the physical diseases. For example, how we react to a disease. Whenever a physical disease happens to your body, how you react to that disease, how you cope with that disease can differ from person to person. So, there are mental factors associated with every physical disease in a general sense, apart from these causal reasons in the psychosomatic diseases. So, for example, skin diseases or rashes in the body part can influence people, particularly faces and other body parts, particularly it can influence our reactions very strongly. And obviously, whenever we have mental illnesses, it may have physical connections to it, in the sense that certain mental illnesses such as depression, people stop eating, they stop taking care of themselves. So, this may further cause other physical diseases or worsen the existing diseases. So, this is a clear bidirectional relationship. So, every physical disease has a mental aspects, and the mental diseases has some physical aspects to it. So, psychosomatic diseases we need to understand in that context, and particularly some of the physical diseases are very strongly connected with the mental factors. For example, skin diseases, stomach ulcers, high blood pressure, and heart diseases. So, we will look into some of them in more detail. So, in fact, a branch of psychology called health psychology has evolved primarily to understand the psychosomatic aspects of diseases, and it investigates the role of psychological factors such as stress, emotion, beliefs, etc. on our physical health and illnesses. So, we have a whole branch of study based on the psychosomatic aspects of diseases, and it clearly reflects how important mental factors are in physical diseases, particularly experience such as stress. Now, if you look at the historical background of psychosomatic diseases, there are some of the important landmarks we can find, we can discuss. So, Claude Bernard in 1878 he used the term dynamic equilibrium to understand the diseases. So, basically he says the dynamic equilibrium is the stability or consistency of the inner environment. So, at the physiological level, whether your body is stable, consistent, or at the equilibrium stage. So, that equilibrium basically shows your healthy state. So, if that equilibrium state is kind of disturbed, such disturbances may adversely affect our body and may cause diseases. So, this was one of the first concept in terms of understanding psychosomatic diseases proposed by Bernard. Then in Walter Cannon in 1929 he used another term called homeostasis as an extension of dynamic equilibrium concept of Bernard. By homeostasis he meant almost same thing. So, basically he is talking about the maintenance of a constant inner condition is homeostasis. So, maintenance of homeostasis of the body is basically maintaining a constant inner conditions of the body. But some experience such as stress, which may lead to fight and flight response, disturbs this homeostasis and can lead to diseases. So, basically Bernard said that maintenance of life is basically dependent on this maintaining of homeostasis in our body. So, this is very crucial for maintenance of life. So, he hence Selye used the term to represent this effect that stress is a condition that disturbs that homeostasis basically and may lead to various diseases. Then obviously Hans Selye who did lot of research in 60s, 70s on stress, he proposed, as we have already discussed, the concept of general adaptation syndrome, where he described physiological response of the body, both short term and long term, in terms of stress, both acute stress as well as chronic stress. So, he discussed alarm stage, which is more like activation of fight and flight and activation of sympathetic part of autonomic nervous system. Resistance stage was associated with release of cortisol and very other stress hormones, particularly cortisol from the HP axis. In the exhaustion stage was basically associated with various diseases of adaptation, which were particularly called as psychosomatic diseases. So, this exhaustion stage where the resistance of the body is minimized and sometimes it may collapse, and as a result body kinds of expresses this decrease of resistance in terms of various diseases which are called as psychosomatic diseases or called as diseases of adaptation. So, hence LEVE kinds of then further elaborated on this idea of psychosomatic diseases. Recently, a whole branch of study evolved, which is called as psychoneuroimmunology, which is in short called as PNI. It's a field of study based on this mind body connection, which revealed that there is a constant interaction between our central nervous system and immune system, and obviously central nervous system is influenced by our mental processes. So, our mental processes can influence our nervous system, which can influence the body's immune system. So, many studies indicated that psychological factors such as stress can influence our central nervous system, and which in turn can influence our immune system. So, this area of study is clearly kind of evolving this whole idea of psychosomatic diseases and playing very important role. So, we will look into this particular branch of study in more detail in the next lecture, when we will talk about stress and infectious diseases, where we will specifically look into the connection between stress and immune system. Now, we have kind of tried to understand and gave you an historical background about the psychosomatic diseases and how stress can cause as well as worsen the physical diseases. Now, we will talk about what are the pathways that can link stress and health. What is the mechanism by which stressful experiences can influence our physical health. So, this is a diagrammatic representation of mechanisms. So, here you can see there are two pathways by which stress can influence physical health or illnesses. One is stress, particularly the distress part or the negative experiences of the stress can directly influence our physiological reactions of the body or physiological mechanisms, which include sympathetic nervous system and neuroendocrine system, and we have already looked into that part in detail in the last lecture. Stress may also influence our immune system. This we will discuss in more detail in the next lecture. So, by influencing our physiology, particularly nervous system, endocrine system and immune system, stress can cause physical illnesses. This is the one pathway. The second pathway is stress can influence our behavioral reactions or responses, particularly our behavior may change under stressful circumstances, such as changes in the health practices or lifestyles, changes in the adherence to medical advices. So, we will look more detail into that part also. So, many behavioral changes may be associated with the stressful experiences, which may further worsen the diseases. So, these are two pathways basically that you can at least literature shows that through these two pathways stress influences physical health. So, basically more simpler form, if I show you, it could be shown like this. So, this is more simpler form by which we can kind of understand the mechanisms. So, there are two pathways, physiological changes and behavioral changes in response to stress can lead to physical illnesses. Now, stress can influence or cause both infectious as well as non-infectious diseases. So, if you look at physical diseases, broadly we can categorize them into infectious or communicable diseases and non-infectious or non-communicable diseases. So, stress can lead to both infectious and non-infectious diseases. Infectious diseases occur due to attack from an external agent such as bacteria, viruses. So, primarily it comes from outside and it can be transmitted from one person to another person because the agents are bacteria and viruses that can transfer from one person to another person. So, that is why they are also called as communicable diseases. Non-infectious diseases on the other hand occur primarily because of internal factors such as wear and tear or malfunctioning in certain organs of the body, and these are not transmitted from one person to another person. So, therefore, they are also called as non-communicable diseases. So, basically these are some malfunctions in the organs of the body. So we have various diseases such as heart diseases, diabetes. So, these are all non-communicable or non-infectious diseases. So, flu is a probably it could be a communicable disease because it can be it is caused by germs such as viruses. So, stress can influence or cause both categories of these diseases. The today's lecture will primarily focus on non-communicable diseases and how stress is connected to that. Now, it was evident that physiological response to stress is very complex and we do not know everything about it, but what we understand is primarily it is done by two pathways. One is SAM system and one is HPA system, and both the system end up releasing hormones such as adrenaline, noradrenaline, cortisol, etc. Now, the question is this is the primary physiological mechanism. Now, the question is how the secretion of these hormones or stress hormones can lead to both infectious as well as non-infectious diseases. So, this is the question we will try to understand. Today, we will try to understand non-infectious diseases part. So, stress can contribute to the development of diverse non-infectious diseases that were earlier believed as purely physiological in origin, such as cardiovascular diseases. So, these diseases were primarily earlier people used to think their origin is primarily physiological or in the body, but recent researches clearly show such diseases can be contributed by mental factor in a very large way. So, they are kind of psychosomatic diseases. So, there are staggering statistics associated with stress and the diseases, particularly non-infectious diseases. For example, I will just read out some of these findings. So, stress related non-communicable diseases or NCDs such as coronary heart diseases, diabetes, coronary pulmonary diseases, neuropsychiatric diseases, etc. are the major health crises in the 21st century, because they are major reason for deaths related to various physical diseases. So, they are causing major crises in the 21st century in terms of disease management. According to the Centers for Disease Control and Prevention (CDC) division of global health protection. The NCDs or non-communicable diseases are responsible for more than 68% of deaths worldwide and 75% of deaths in low and middle income countries. So, you can understand the huge impact such diseases have on in the lives of people, and they are mostly caused by factors such as stress. NCDs are generally preceded by stress related metabolic problems such as hypertension, high cholesterol, reduced responsiveness to insulin. So, all these metabolic changes happens by the stress, and they ultimately causes all these non-communicable diseases, particularly psychosomatic diseases. So, reduced responsiveness to insulin may lead to diabetes, high cholesterol may lead to heart diseases, high blood pressure lead to hypertension. So, all these are metabolic changes are caused by stress related factors, and they may further lead to various non-communicable diseases. Stress related chronic non-communicable diseases continue to plague primary care practitioners, resulting in enormous mortality, morbidity and suffering, and contributes to the expanding of healthcare cost. So, they are huge burden on the primary healthcare system and overall disease burden of various countries. So, these are major chunk of diseases that we all experience, and interestingly they are all influenced by maybe influenced very strongly by stress related factors. So, let us talk now more about specifically about cardiovascular disease, because this is one category of disease where stress seems to play most important role. So, cardiovascular system basically includes heart, blood and blood vessels, and it is primarily regulated by autonomic nervous system. So, now you can understand the connection, because these are regulated by autonomic nervous system, and autonomic nervous system can be influenced by stress. So, cardiovascular diseases are the leading cause of death globally and causing an estimate of 17.9 million lives each year. This is in statistics given by WHO in this year only. So, cardiovascular disease are really a huge category of disease that are causing one of the largest death globally. So, disease related to cardiovascular system primarily include coronary artery diseases, coronary heart diseases and hypertension. So, primarily heart diseases and hypertension or high blood pressure are included under cardiovascular diseases. Now, coronary heart disease develops particularly when our arteries of the heart or the blood vessels that supply oxygen and blood to the heart. So, the vessels that are connected to the heart which are called as arteries, when they become narrow due to fatty deposits or deposits of the cholesterol in those arterial wall, and as a result blood is not able to freely flow from the heart and to the heart, and this is called as atherosclerosis. So, we will also look little bit more deeper into that also. So, this is the primary reasons, one of the primary reason for heart disease, that is the blockage in the artery by the cholesterol or fatty deposits. Hypertension on the other hand is basically high blood pressure. It is a condition in which the force of the blood basically against the wall of the artery generally becomes higher than the normal situation, and it can lead to heart diseases, strokes, kidney diseases, etc., sometimes death also. So, and for example, the ideal blood pressure is generally considered, the normal blood pressure is between 90 by 60 mmHg, basically means millimeter of mercury. This is the unit of measuring blood pressure. So, 90 by 60 to 120 by 80 mmHg is the normal range of blood pressure. Anything above that is considered higher, particularly if it is 140 by 90 mmHg or more can be considered as hypertension. So, basically these two counts are, one is the top count is basically systolic blood pressure and one is called diastolic blood pressure. So, systolic blood pressure is basically when heart beats, you measure the pressure of the blood, and diastolic is when heart is not beating. So, 90 by 60 means one is 96 systolic and 60 is diastolic measure. So, how stress contributes to cardiovascular diseases, particularly heart disease. So, obviously, the mechanisms are very complex and it is still not very clear. However, there are many possible pathways that have been linked with cardiovascular disease and the stress. One is the experience of stress can cause high levels of physiological arousal, leading to erratic and rapid heartbeats, which can cause stroke, cardiac arrest or even death of the person, especially to individuals with pre-existing heart conditions or diseases. So, one thing is very clear, immediately with the experience of stress, the heartbeats get faster, especially under the fight and flight response. Heartbeat becomes very erratic and faster, and and when it is experienced again and again can cause wear and tear in the system, particularly in the muscles of the heart, due to repeated fight and flight response, and can cause heart related problems. So, this could be one direct mechanisms where how stress can directly cause heart related issues by particularly causing wear and tear in the system due to repeated fight and flight responses. Another way by which stress is connected to heart diseases is through stress hormones which are released during stressful situations. So, this cortisol, epinephrine, norepinephrine. So, these are stress hormones. Now, research have shown that this stress hormones actually promotes atherosclerosis. So, we have discussed it basically means it blocks the arteries by increasing cholesterol level, by increasing the buildup of fatty patches or plaques on the arterial wall, which leads to the narrowing down of the artery. So, artery is narrowed down because of buildup of plaques and fatty patches in the arterial wall. This narrow artery decreases the blood flow, resulting in the increase of the blood pressure. This decreases the blood flow, causes less oxygen flow to the heart muscles, which may result in chest pain, which is also called angina, and heart attack. So, stress hormones can promote atherosclerosis, which ultimately can block the arterial wall and increase the blood pressure by decreasing the flow of the blood and less oxygen in the heart. So, arterial wall and how this build up can be, I will just show you how this is basically So, for example, let us say this is a cross section of the artery, and this is kind of the cross section of that arterial wall. So, this is a normal arterial opening of the artery, but when atherosclerosis happens, this fatty cholesterols or patches kind of gets built up around this artery, and as a result the area of for the flow of the blood decreases, which further increases the blood pressure. So, this is how kind of atherosclerosis happens in the arterial wall. There is another symptoms which is also connected to stress and heart disease, is called as broken heart syndrome. Now, stress can cause broken heart syndrome, and it is more prominent among women following stressful or traumatic events. So, according to Johns Hopkins Medicine's website, how they define this syndrome is that the broken heart syndrome is a condition in which intense emotional or physical stress can cause rapid and severe heart muscle weakness. So, with the increase of the stress, heart beat so faster, particularly if it is a very traumatic, highly stressful event, suddenly the heartbeat increases so fast that it weakens the muscles of the heart, which is technically called as cardiomyopathy. So, with stress or the cardiomyopathy, we believe that heart muscle is overwhelmed by a massive amount of adrenaline, release of adrenaline that is suddenly produced in response to stress. So, suddenly there is a high intensity of stress and there is too much of stress hormone and too much of erratic movement in the heart, which can overwhelm the heart, functioning of the heart. The precise way in which adrenaline affects the heart is unknown, but it may cause narrowing of the arteries that supply the heart with blood, causing a temporary decrease in the blood flow of the heart. So, it is possible that that kind of shrinks temporarily because of these erratic movements and the effect of adrenaline, and as a result you experience a kind of symptoms of heart attack. Now, this broken heart symptom is basically a stress induced symptom, can happen to a normal and a healthy person. So, according to the American Heart Association website, women are more likely than men to experience sudden intense chest pain, which is basically reaction to a sudden surge of stress hormones. It could be due to death of a loved ones, suddenly you hear about such traumatic events, or even a divorce, breakup or physical separation, betrayal or romantic rejection. These are some of the traumatic events. For example, in response to such events, broken heart syndrome can happen, because these are very traumatic and stressful events. Sometimes it could even happen after a good shock, let us say suddenly winning a lottery. So, it can also overwhelm your physiological response. So, broken heart syndrome may be misdiagnosed as a heart attack. So, it is not exactly heart attack, because the symptom is very similar to heart attack, but in heart attack happens primarily because of blockage of the artery by cholesterols and other plaques. So, generally it happens due to blockage of the artery, but broken heart symptoms may not be connected with the blockage, but it may happen suddenly. So, it can happen to a healthy person in response to a highly traumatic event. Now, another important connection between stress and heart diseases is the connection between stress and cholesterol. Now, stress can increase bad cholesterol. So, there are two types of cholesterol, one is called as bad cholesterol and another is called as good cholesterol. So, bad cholesterol is basically called as LDL or low density lipoproteins, and good cholesterols are called as high density lipoproteins or HDL. So, stress can increase the bad cholesterol level of the body directly or indirectly directly by stimulating production in the body, or indirectly through unhealthy behaviors such as eating unhealthy foods. So, for example, there are many empirical evidences to that. A study by Catalina Romario and his colleagues in 2013, they collected data from more than 91,000 participants and found a positive correlation between those who experienced high job stress and bad cholesterol level in their body. So, those who have experienced higher stress in their life, their blood cholesterol, particularly the bad cholesterol level in their blood was much higher than the people who experienced less stress. Another study by Asadi 2017 found that psychological stress can lead to higher levels of bad cholesterol, which are basically low density lipoproteins, and decrease good cholesterol. So, it can functions in both ways, by increasing bad cholesterol level and decreasing good cholesterol level. Now, stress hormones such as adrenaline and cortisol can trigger the production of cholesterol, which is basically, cholesterol is a kind of waxy and fatty substance produced by the liver, and it is produced primarily to give you extra energy during the stressful circumstances. However, when it is released too much because of excessive stress experiences, there may be too much of excess cholesterol on excess energy. When it is not used, may get accumulated in the body as fats, and excess cholesterol can clog the arteries or block the arteries, and basically it can cause to atherosclerosis, and which ultimately may cause heart diseases or heart attacks. So, this is one basically direct mechanisms, and obviously another way is stress can induce various behavioral changes, particularly eating behaviors and eatings of unhealthy foods such as carbohydrate, which may further increase cholesterol levels in the body. So, through this mechanism, stress can influence your cholesterol level in the body, which particularly the bad cholesterol, which can then further lead to heart diseases. Another important connection between stress and heart diseases is through personality trait. Two researchers or heart doctors named Friedman and Rosenman in 1974, they suggested that people with certain personality characteristics or traits are more predisposed or more vulnerable to suffer from stress than other people, because there are different characteristics of personality. So, consequently, they are more likely to have heart disease because they are more likely to experience stress in their life. So, in that context, they identified two personality traits. One is called as type A people and type B people. So, type A personality trait, type B personality trait. So, what are they tried to find out these two types of people by asking simple questions such as, do you feel guilty if you use spare time to relax? Do you need to win in order to derive enjoyment from game and sports? Do you always need to win to derive enjoyment? Do you generally move, walk and eat rapidly? Do you often try to do more than one thing at a time? So, these are some of the sample questions. Obviously, it had many more questions, and they asked such questions, and if your answer is yes to this kind of questions, you are more likely to be type A personality. what happens, what are the characteristics of type A people? So, they found that type A people, they show excessive competitiveness and achievement orientation, which lead to extreme self criticism. They also criticize themselves too much. They have excessive competitiveness in their mind, and they are highly achievement oriented people. They have an exaggerated sense of time urgency, which leads to constant struggle against the clock and a compulsion to try to do more than one thing at a time. So, time urgency, excessive competitiveness, achievement orientation. Then the third factor is anger, hostility that may or may not be openly expressed. So, these are the three important or the prime characteristics of type A people, and type B people show opposite characteristics. Basically, they are very easygoing and much less demanding of self and others, and they do not have exaggerated sense of time urgency. So, type B people are more relaxed kind of people. Type A people, because of this nature, they are more likely to be stressed most of the time in their life. So, these are two different types of people. That there is nothing wrong in being type A or type B. These are only the different types of people, different psychological makeup. So, this Friedman and Rosenman conducted a longitudinal study, which basically means studying a group of people over a period of time for 8.5 years with a sample of 3,524 men and men which were aged between 39 to 59 years, and they found that type A individuals were twice as likely to develop coronary heart disease than type B individuals, primarily due to higher physiological reactivity of type A people than type B people. So, the type A characteristics makes these people more vulnerable for heart diseases, primarily because of their psychological makeup. They are more likely to experience stress and physiological reactivity, which may increase the risk of heart disease. That does not mean type A people will automatically experience heart disease, but they are more likely to experience heart diseases because of their the nature, inbuilt nature and personality trait. They are more likely to experience stress, and we know stress can increase the chances of heart disease. Now, later research indicated that only some aspects of type A behavior, particularly the anger and hostility, are more important in terms of understanding heart disease. So, other aspects may not be that strongly connected to heart disease, but anger and hostility are particularly more strongly connected to heart diseases. Some research also indicated that particularly anger which is suppressed. Some people when they are angry, they kind of suppressed it, and it kinds of gets accumulated in the system, in the physiology of the system. Such suppressed anger is more significantly the risk factor for higher physiological reactivity and coronary heart disease. It was also reported that individuals who suppress their anger are twice vulnerable to mortality than the expressed anger. So, it may not be all the characteristics of the type A people, but some characteristics, particularly the anger and the suppressed anger, could be more important in terms of causing heart diseases. Now, the last thing that we will discuss is basically the behavioral pathways. So, obviously, the stress cause non-infectious diseases. One is through physiological responses that we have discussed. And now, there is another way that it can cause non-infectious diseases is through behavioral pathways. So, stress can adversely affect health by increasing the frequency of unhealthy behaviors. So, under stressful circumstances, people are more likely to behave or involve into unhealthy behaviors, and healthy behaviors are likely to decrease, or by disrupting prescribed healthy behaviors pattern. So, under stressful circumstances, all these things can be disrupted. So, frequency of unhealthy behavior may increase, frequency of healthy behavior may decrease, or healthy behavior patterns may be disrupted by stressful circumstances of life. All this may ultimately can cause further complications in the physical diseases. So, stress may induce many behavioral changes and disruptions in lifestyles and routines. Some of the common findings are, for example, changes include disturbances in sleep, which is very strongly connected with the stressful experiences, disturbances in food intake, unhealthy food, overeating, excessive smoking or other addictive behaviors may increase. Physical inactivity also increase under stressful circumstances. People may involve into excessive drinking of alcohol, drugs, etc. So, all such behaviors are problematic, we all know, and especially for people with pre-existing illnesses such as heart diseases can further complicate the physical diseases and worsen those symptoms and cause also physical diseases. So, these are the behavioral pathways through which stress can influence our influence non-infectious diseases. So, we can understand it is very complex and there are many possible mechanisms, but at least we try to understand some of the major pathways by which stress is connected to non-infectious diseases or non-communicable diseases. Next lecture we will talk about how stress is connected to infectious diseases, or specifically how it is linked to immune system. So, with this I end today's lecture. Thank you.